I'm going to date myself and start talking about the Jetsons on This is Manitoba. I'm Marcy Marcuso with Corey Funke. Corey.
Hello.
And Abby Adiyemi. Abby, hi.
How you doing?
I'm good. So you remember the Jetsons? Did you watch that cartoon?
Oh, yes, I did.
Yeah. So the Jetsons, of course, they had somebody that would robotically do everything. All of their assistants were robots. But we're talking about that in the podcast today because robots are making themselves known in healthcare. In remote parts of Manitoba, which can be very beneficial depending on the use. But I hear you're on the fence about robots in healthcare.
I just don't know. I'm trying to picture myself walking into the doctor's office for my appointment, and there's a robot there to save me from that small talk from the receptionist. And then it says, place your arm in this place. And I'm like, okay. And it goes, 404, error. Heartbeat not felt.
Got it. So you're just imagining them administering a shot or something physical, and all of a sudden it's like they're offline.
Exactly.
No go. Well, I guess it's a risk. What we're going to hear, as I said, about some more positive things today on This is Manitoba. Specifically, where are we going to take you? Well, we're going to take you to some, as I mentioned, remote northern communities, specifically Lake Manitoba First Nation and Penemuitang First Nation, because CBC Manitoba reporter Brittany Greenslade was up there looking at how robots are factoring into healthcare. And it is a positive thing right now in terms of bringing healthcare to remote areas that otherwise wouldn't be able to follow up with things like specialists. And we might take that for granted here in southern Manitoba. Also on the podcast today, Portage and Main. It's going to be open sooner than later, summer 2025. What is foot traffic returning to Portage and Main, though, going to mean for Winnipeg's downtown? This is Manitoba. Lots to explore. All right, let's get started. Specifically with the robot story. So we're going to hear more about how it's actually working on the ground. This new service that I alluded to is being offered in 2 First Nation communities that I mentioned there. Brittany Greenslade was in Lake Manitoba First Nation and Penemuitang to see more about how people are accessing healthcare through the bots.
Clinton Anderson is lucky to be alive, let alone walking.
My life is no longer the same from what it was before. I was the one who took the brunt end of that collision there.
He has a physical reminder of it every day.
Right here is where I had that muscle and lacerations from the accident, and there's also bone chips in my elbow here.
20 months ago, he was driving a work vehicle on a winter road in Ontario when a semi-truck failed to call ahead on the radio system and came quickly around a blind corner.
We weren't expecting anything, and we were just driving casually, and when we come around one corner, there's a truck in our lane, so when you're on a winter road, there's nowhere really to go except for the snowbank or the vehicle.
While doctors were able to mend his injuries, he needs months of intense physical therapy to regain his strength and mobility. But living in Penemuitang First Nation, more than 240 kilometers from Winnipeg, getting the help he needed was a struggle.
When I started going to my physio in Winnipeg, it would be, 3.5 hour drive, 3 hours. And I would only book on weekends, so I'd have to book a Friday evening and then a Saturday afternoon.
It's a burden and a barrier and means many go without. But now that's changing.
Good morning, Tim.
This robot, lovably dubbed Wally, helps to provide care on site, so people in Penemuitang and Lake Manitoba First Nation don't need to leave their communities. Virtual physio enables outreach beyond the perimeter.
So it's definitely a big need. We learned that pretty early on. We realized it's not that people don't need physio, it's that they just don't have the easiest access to physio.
With the help of an assistant on location, twice a week, Tim Romanek can offer virtual rehab sessions from Winnipeg. This way, patients can see their therapist and interact, not just hear them.
And I want you to bring them apart.
In turn, Romanek can make sure movements and exercises are being done correctly.
It's big in terms of efficiency and continuity of care, so being able to see a person more frequently.
But it did take a little getting used to.
I didn't understand right at the time, then all of a sudden that robot walking came in the room and there he was. I said, oh, playing hooky, eh?
Every second week, Romanek also travels to the Interlake to see clients like Dwayne Moore in person. For Moore, at 78 years old, traveling to Winnipeg for rehab just isn't feasible. The drive or the cost.
I have a truck, and it's about $150 there and back, So on a senior's pension.
The program is a partnership between the two First Nations, Riverview Health Centre, the University of Manitoba, and the Regional Health Authority, improving the quality of life for people in those Indigenous communities.
So it's important, especially as anyone gets older, really, just to maintain quality of life and independence, so people can do the things they like to do and they need to do, and keep their mobility and their function as they age and stay pain-free as long as they can.
It's one way the First Nations are able to address long-standing healthcare vacancies. Trying to staff positions in the community and keep them filled has long been problematic.
We had one doctor when I was growing up. He was here for 2 half days a week, and that was it. All of our services were either in one of the local hospitals while they had services still available, but they've gradually moved to larger urban clusters.
Health Director Lawrence West says this hybrid model can bring services back and expand them.
I've seen a lot of my people who suffer without access to services, and I'm a big believer that services delivered locally make the community healthier.
While this isn't a perfect solution, it is one that's helping to bridge the gap.
The services provided locally, they not only provide a quality of life for the people that are accessing them, but it also reduces the burden on the wider healthcare system.
And hopefully keeping people in their communities and homes for longer, helping these First Nations thrive.
Hi, my name is Mela and I'm from Winnipeg, and this is Manitoba.
Well, let's talk Portage and Main on the podcast now. Did I just hear you sigh or groan over
I can
there?
feel my blood vessels tightening.
Okay, that is because we've been talking so much about this iconic intersection in Winnipeg, which has been closed since 1979 to people crossing on foot, right? You can't go across Portage and Main. So we decided we didn't want to. We just leave it closed to cars. That was that plebiscite that came up. But now, because of the cost of fixing the underground stuff, it's over. It doesn't matter what the plebiscite said. We are actually in the process of getting ready to reopen Portage and Main. So we've talked a lot about this. You were looking forward to it, though, Corey, kind of for the bigger picture reasons, though.
Yeah, I mean, if I think about it, all I've ever known is a closed Portage and Main. And now with, 2 kids, one's 2 years old, one's a newborn, all they're ever going to know is an open Portage and Main.
I guess so, right?
Yeah, and I mean, that's exciting, the possibilities that maybe, just maybe, we could have a downtown where my kids actually want to go and spend time and move around and get from place to place without trying to figure out how to get down underground. And
does the closure of Portage and Main, is that intersection a symbol for the greater downtown for you in a way? In terms of vibrancy or accessibility?
It just sends a message, sure, you can come downtown, but good luck getting anywhere. Get A to B. You can see the building you want to get to across the street, but it's no.
Yeah.
You got to do this whole rigmarole, and it doesn't send the good message.
So the big hope is that the Forks and the way people feel about the development there will be connected and flow into the downtown and create some new vibrancy.
Yeah, exactly. And it's fun thinking about it in the fact that I'm the same age as the Forks. Mm-hmm. It started early 90s. I was born early 90s. I grew up with it. And I'm really proud of the Forks and where it's gone. And it's a great place to go when people come in town. I want to go there too. And I hope it's the same thing for my kids with Portage and Main and downtown in general, that as the downtown hopefully becomes more vibrant, my kids grow up with that, and it becomes a place where they identify with as they grow up too. And
then when people come to town, they say, hey, let's go downtown.
Let's go downtown.
Right? Okay, well, we'll see if that's going to develop because your kids are little.
Yeah.
But step one, let's dig into that, shall we? Step one is the reopening of Portage and Main to pedestrian foot traffic. So this is going to happen in summer 2025. But will it result in bigger vibrancy and better vibrancy rather for our downtown. Ben Farr's been writing about this and thinking about this. He is CBC Manitoba's urban living contributor, and here's his latest column on our podcast. So let's start with a bit of the history. For a lot of people listening, they may not know all of the history to this. So let's remind people why the city originally closed the intersection to pedestrians in the 70s in the first place.
Mm-hmm. Yeah, it really does all come back to the 70s, back when Winnipeg was starting to see a bit of a decline in the downtown. So they were looking at what was causing it, and what they found were that people were leaving the downtown core and heading for the suburbs. There was a lot of development in the suburbs, so they were looking for ways to bring them back downtown, and they thought that prioritizing the car would be a fantastic way to do that. With the pitch of a new underground mall at the corner, which is now Winnipeg Square, they thought that closing the corner would help to get people driving into the downtown core, and by bringing them underground, it would help them to use that new mall and spend time downtown once again.
So now 2018 is the next year we're going to take us to, from the 70s to 2018, because that was the year of the big plebiscite where Winnipeggers were asked, this was attached to our election vote in the fall, whether or not they wanted the intersection reopened, Portage and Main. So people said no. Mm-hmm. What changed?
It was two main factors that caused people to vote no back in 2018. The first being traffic, and the second being costs. Back then, it was going to cost around $11 million to reopen the corner. But in the last 6 years, conditions have changed a lot. The underground concourse needs some pretty hefty repairs that come with a price tag of $73 million now, and will cause 4 to 5 years of traffic delays, all to buy us another 40 to 50 years with the underground concourse and the intersection closed once again. So City Council decided, instead of going back to another plebiscite or debating, that they would vote to reopen the corner. And my favorite quote is from Mayor Scott Gillingham: "It's time to deal with the Portage and Main issue once and for all."
So in your research, I know that you went to Cleveland. You looked at Cleveland. You found that Cleveland saw positive changes when planners put people ahead of cars. So you have an example that is relevant to the conversation. What happened in Cleveland?
Mm-hmm. So post 9/11, Cleveland was having similar issues with their downtown core that Winnipeg had in the 70s, but they took a different approach. Instead of prioritizing cars, they prioritized pedestrians and cyclists in their downtown. And after about a decade, what they found was that their downtown core's population had increased by over 30%. Their downtown core was far more vibrant, more welcoming for different people across the community, and more accessible for people with all sorts of different transportation modes.
That was in the 70s, though, or sorry, back in the day, though, right? So this is the question I have as a Winnipegger, right? Can we do that now? After all of these years of not prioritizing people, will it make a difference? Mm-hmm. You look at other cities in your report, too. So you looked at an initiative on Toronto's Bloor Street. What happened there?
Mm-hmm. Again, it was relatively similar. On Bloor Street in Toronto, they decided in 2016 to remove 100 on-street parking spaces and replace them with bike lanes. And at the beginning, business owners were very concerned that they were going to lose traffic into their businesses, lose sales, because people wouldn't be able to access their businesses as easily. But once those bike lanes were opened, they found the exact opposite. There was more people on the sidewalks in the community and ultimately spending time in their businesses. So they ended up thriving after, not suffering like they thought they would.
And I should clarify here, sorry, because the Cleveland research you were citing, as you said, was post 9/11 when they made their changes. So we're looking back at the 70s, but post 9/11 for that. And Toronto was 2016, you said, for this example. What do you think we can learn from those cities here in Winnipeg?
I think we do have quite a bit we can learn from those two cities, mainly that the big thing we need to prioritize is getting people to visit our downtown and finding ways to do that. When they did that, they saw a positive change. So right now, our downtown, and specifically at Portage and Main, it's set up to get people in and out and through that corner, whether they're in cars or underground in the concourse. But if we can find ways to get people using our downtown by prioritizing pedestrians and cyclists and even transit with a new transit hub that's opening up at Portage and Main in the future, it should cause a lot of positive change and make people spend more time downtown in those local businesses, in the local communities as well.
It's interesting because up to now, I would argue, and I've covered all these stories, leading up in great detail, we do focus a lot on what it will mean to open the intersection. And I mean like the logistics of the physically moving people or cars through that big intersection. But now that we know what's happening, is you're suggesting the real shift to looking at what could that impact be and why, what do we need that impact to be? How will opening Portage and Main to pedestrians benefit downtown potentially then? You're kind of setting this up.
Mm-hmm. I see the biggest difference being that downtown communities are going to be reconnected for the first time in 45 years. I mean, vibrant communities like the Exchange District and the Forks are currently separated by Portage and Main. So reconnecting those communities and making downtown a little bit more whole for people to engage with will help to make it more vibrant and make it more welcoming for people who may not spend a lot of time downtown right now.
So it feels a little bit painful, I won't lie, you guys, that on the podcast today we're talking about Portage and Main and downtown vibrancy and people gathering. And I'm still sort of stinging because I kind of thought we were going to have a Grey Cup gathering there this year.
Yeah, a little sad.
You know what? It'll happen. And honestly, for those of you that haven't experienced gatherings at Portage and Main, I can attest they actually are really fun. You might be saying, well, why do we need to be there at that big intersection? But they're fun. Big Jets games, past closures for the Grey Cups when I was a kid in the 80s, you know, honestly, 80s, 90s. Teenagers celebrating Grey Cup parades through Portage and Main. Used to go to concerts.
I went to Great Big
Close
C as
them
a
off.
kid. It
Did
was
you?
dope. Yeah.
Fun, right?
Mm-hmm.
So some of that's fun. Very expensive, I get it. But we'll see what the future holds for Portage and Main. We'll hoist the Grey Cup at some point, right, Abby?
I know the Blue Bombers fought hard. The city's still proud of them. I am proud of them. I'm still a fan. I'm still representing blue. And I will stay blue.
Oh, I like that. Let's end our podcast there. This is Manitoba.
Follow and share.